Hello my dear students, Assalamu alaikum. Hope you are doing good. I am Dr. Karim Rezwan Hassan, Associate Professor, Department of Anatomy, Abdin Women's Medical College. Today, my topic is Introduction of Bones of the Inferior Extremity. That means today I will introduce you about the different kind of bones that is present at the lower limb. Before proceeding to that, we need to know that what is the purpose of different kind of bones that is present at the inferior extremity. With the inferior extremity or the lower limbs, we are actually moving. We are moving ourselves from one place to another. And all the bones that is present at the inferior extremity are doing their purpose in a different way. So, the surface, shape, architecture and everything of different bones are totally different from each other. Even some of the bones are morphologically and histologically are completely different. Today we will discuss about that thing. Today I will introduce you each and individual bones with their some of the morphological features, their type and some of the joints that is formed between them. Let's start. First of all, you can see this is a articulated bony pelvis. You already know that articulated bony pelvis is formed mainly by the three types of bone. Two hip bone and a sacrum. You know that these hip bones are present bilaterally on each side and the sacrum is present at the midline. Now let's see, this articulated bone is formed mainly by the hip bones like this and sacrum like this. Let's see individual bones. This is a hip bone. You can see that this hip bone doesn't have any particular shape. We call it irregular bone. As you know that all the irregular bones are having some particular features. This hip bone is mainly formed by three parts. Over here you can see this is the ilium. Over here you can see this small quadrangular part, it is the pubis. And over here you can see this is the ischium. So the hip bone is mainly formed by three bones. Ilium, which is the larger one, then a smaller one, pubis, and the ischium. You can see there is a concavity over here. This is called the acetabulum. And you can also see that all these three parts are connected by the acetabulum. This foramen is called the obturator foramen. Now in the ilium, it is having two surfaces. One is over here, another one is over here. This is the iliac surface or iliac fossa. And over here, this is the gluteal surface because of the attachment of the gluteal muscles. Today, we will not discuss about the attachment. This is the iliac crest. Over here, you can see a surface which seems very much irregular. Actually, over here, the sacrum is attached. That is called the sacroiliac joint. Remember, sacroiliac joint is a type of joint which has two types of joint. Number one, plain type of synovial joint which is present over here, the auricular surface, and this irregular surface, when it is articulating with this surface of the sacrum, actually it is forming the fibrous joint. So sacroiliac joint is a type of plain type of synovial joint cum fibrous joint or syndesmosis. Now this hip bone with the acetabulum is articulating with the head of the femur. Let me show you the head of the femur. You can see this is the head of the femur. So this head is articulating with this hip bone. Let me show you like this. So you can see that head of the femur is articulating with the acetabulum of the hip bone, and this joint is called hip joint, which is ball and socket type of synovial joint. It is the largest ball and socket type of synovial joint. So before proceeding to the femur, let's talk about the sacrum. Sacrum is mainly formed by the sacral vertebrae. There are 5 types of sacral vertebrae. All are joined together, so it's a conjoined bone. So you can see that it is having a sacral surface and the posterior or irregular surface as well. Now these foramen are the ventral sacral foramina and these foramens are dorsal sacral foramina. You can see there is a space over here that is called the sacral hiatus. Whenever we will discuss about the each and individual bone in details, we will discuss about these features in details as well. So don't worry. Now let's talk about the femur. You know that femur is one of the most strongest and the longest long bone in our body. It should be strongest because it is bearing the weight of our upper body. Now you know that any kind of typical long bones are having two ends and the shaft in between. This is the upper end, this is the lower end, and this is the shaft in between. You can see that the upper end bears the rounded head. You can see over here, this is the rounded head, then a constricted part which is actually the neck, then it is having a larger kind of projection which is called the greater trochanter, and a smaller projection which is called the lesser trochanter. At the same time, at the lower end you can see there are two condyles. One is medial condyle, another one is lateral condyle. And in between the condyles, this is intercondylar fossa. Now the femur is having another very much features which are present in the shaft. It is the anterior surface, it is the medial surface, and obviously this will be the lateral surface. Now you know that femur is a type of long bone, so you know that all long bones are having some kind of epiphysis. I have told you that there are two types of epiphysis in the long bone usually. One is pressure epiphysis, another one is traction epiphysis. Over here, this head of the femur, these condyles of the femurs are the example of pressure epiphysis. On the other hand, this trochanter, that is the greater trochanter and the lesser trochanter, these trochanters are the example of traction epiphysis. So femur is having some of the features which are very much familiar with the other long bones. Now let me tell you one thing, this femur is articulating with two bones inferiorly, but superiorly it is articulating with the acetabulum of the hip bone, as we already discussed, that will form the hip joint, a ball and socket type of synovial joint. But inferiorly over here, it will articulate in this surface with a particular small bone. Let me show you that. This bone is this bone. This is the patella. The patella will be present over here, and it is called the femoropatellar joint, which is a saddle type of synovial joint. This patella is articulating over here. This is the femoropatellar joint or saddle type of synovial joint. But not only that, a very big bone called tibia is articulating with the inferior condylar surface of the femur. Now this joint is mainly the knee joint. You know, we can flex our knee like this. Now this knee joint is a complex, compound and the condylar variety of synovial joint. From my speech you already know that the condyles of the femur is articulating with the condyles of the tibia, and it is forming the condylar type of synovial joint. But the thing is that in the knee joint cavity, another bone is participating that I have already told you, that is called the patella. So ultimately three bones are present at the knee joint, and that's why it is also called the compound type of synovial joint. Again, this knee joint is somehow divided into two compartments, superior and the inferior compartment, by meniscus, and that's why this knee joint is also called the complex type of synovial joint. So knee joint, it is condylar type of synovial joint just because the articulation is happening between the condyles of the femur and the condyles of the tibia. It is also compound type of synovial joint just because it is articulating with three bones together, femur, patella and the tibia. At the same time, it is complex type of synovial joint because it is having meniscus, which is dividing the joint cavity into upper compartment and the lower compartment. So we understand knee joint is a condylar compound and the complex type of synovial joint. Now you already discussed about what are the joints present at the upper part of your inferior extremity. Let's talk about the other joints that is present at the lower part. We already know that this is the tibia. Tibia is having an expanded upper end and the lower end. The expanded upper end is having two condyles, medial condyle and the lateral condyle. This is called the tibial tuberosity. This is called the intercondylar crest or intercondylar eminence. Now, in this eminence, so many attachments are there, but we will discuss it in the individual bones. Over here, you can see there is a projection at the lower end, which is called the medial malleolus. At the same time, let's see, there is a depression over here for the articulation with another bone. In our leg, there are two bones. One is tibia, but other bone is actually this bone, which is called the fibula. Now, this fibula is having an upper end, lower end and the shaft in between, just like the tibia. The head of the fibula is articulating like this, and you can see there is a joint between the head of the fibula with this surface, and this is called the superior tibiofibular joint. Remember, superior tibiofibular joint, the joint which is present over here, is actually plain type of synovial joint. Superior tibiofibular joint is a plain variety of synovial joint. And at the lower end, this surface of the fibula is articulating with this gap or the fibular facet of the tibia like this. And this joint is not a plain type of synovial joint, it is actually syndesmosis or fibrous joint. At the same time, you can see there is a very big gap between these two bones. You can see the gap in between these two bones. This gap is filled by an interosseous membrane or syndesmosis. So the joint are mainly three: superior tibiofibular joint, which is plain type of synovial joint; inferior tibiofibular joint, which is syndesmosis or fibrous joint; and in between the intermediate tibiofibular joint, there is fibrous sheath, which is also called the syndesmosis. So these are the joints that is present in the leg. Now the thing is that whenever we are going into the foot, we are having a very complex pattern of bones over there. Lot of bones are over there, and combinedly they are called articulated foot. Let's see the articulated foot. Over here you can see an articulated foot, the right sided articulated foot. Lot of bones are over here, you can see, but grossly in the articulated foot we are dividing the articulated foot into different segments. Some are the tarsal bones, some of the metatarsal bones, and some of the phalanges. Over here you can see a very large bone over here. This is actually the calcaneum. At the same time, we can see a very unique shaped bone over here, which is called the talus. Over here we can see, I am using a pen, this bone in front of the talus. This is actually the navicular bone. You can see the navicular bone. Over here you can see a very quadrangular large bone, which is called the cuboid. And over here we can see very identical three bones, 1, 2, 3. These are called three cuneiform bones. So ultimately we can see talus over here, calcaneum over here, navicular over here, cuboid over here, and three cuneiforms over here. All these bones are combinedly called the tarsal bones. Now after the tarsal bones, these bones are present over here, and these bones are called the metatarsal bones. You can see the 5 metatarsal bones. And after the metatarsal bones, these bones, you can see, these are the phalanges, just like the phalanges of the hand. Now you can see the lot of complex bones are over here, and all the bones are forming different kind of joints. Let's see what are the joints present over here. Before that, you need to know that the lower end of the tibia is basically articulating with the upper surface of the talus like this. Okay, so the joint in between the lower surface of the tibia with the upper surface of the talus, this is called the ankle joint. For your kind information, ankle joint is a hinge variety of synovial joint. It is forming the hinge variety of the synovial joint. Now, below the talus and above the calcaneum, talocalcaneal joint, over here, this joint is also known as the subtalar joint. It is called the subtalar joint. This subtalar joint is basically a plain type of synovial joint. Over here you can see another joint that is present in between the calcaneum and the cuboid. Calcaneo-cuboidal joint is plain type of synovial joint. Again, in front of the talus bone and in between the talus and the navicular, this is a joint which is actually saddle variety of the synovial joint. You can see the concavity over here and the convexity of the talus over here. So this is actually what? This is actually talonavicular joint, and that is actually saddle type of synovial joint. Now the joints that is present in between the cuboid and the cuneiform, all those joints are plain type of synovial joint. All those joints are plain type of synovial joint. There is a combined joint. If you see from this angle, you can see there is a combined joint in between the navicular bone, talus bone and the calcaneal, that is called the talocalcalo-navicular joint. It's a incomplete ball and socket type of synovial joint. I am showing you again. Talus, navicular and calcaneum, this joint is almost like a half spherical. So this joint is incomplete ball and socket type of synovial joint. Now you can see that in between the cuboid bone and the cuneiforms, all these intercuneiform and the cuboidocuneiform bones, these joints are basically plain type of synovial joint. Again, in between the cuneiform, cuboid and the metatarsal bone, you can see that is called the tarso-metatarsal joint. These tarso-metatarsal joints, these are also plain type of synovial joint. I am again repeating, all the tarso-metatarsal joints are the plain variety of synovial joint. Now, this calcaneum, talus and navicular, they are sorts of irregular bone, but we consider calcaneum is very much irregular. Talus and the navicular, they are almost cuboid, even they are not fully cuboid, but cuboid itself is very much cuboidal bone, and these cuneiforms are also cuboidal shape, so they are called short bone. And over here, the metatarsal and the phalanges, all these bones are miniature long bone, just like which are present in the hand. Now, in between the intermetatarsal bone, these bones are forming joints in between them at the proximal aspect, and that is also plain type of synovial joint. Intermetatarsal bone, I am repeating again. Now, in between the metatarsal and the first group of phalanges, the joint is metatarsopharyngeal joint, and that metatarsopharyngeal joint is ellipsoid type of synovial joint. I am again repeating, the metatarsopharyngeal joints are ellipsoid type of synovial joint. Now, over here you can see that also there are joints in between the phalanges, which are called the interpharyngeal joints. Remember, just like the bones of the hand, the interpharyngeal joints are hinge variety of synovial joint. Interpharyngeal joints we can see over here, these are the hinge variety of synovial joint. So ultimately, we know that there are different type of bones, and all the bones are having their different kind of morphologies. All the bones are having their unique features, and all the bones are forming different kind of joints in between them. Not all the bones are doing the same purpose. You know, the most strongest bone in our body is the femur, which is bearing the weight. At the same time, that weight has to go to the tibia and the fibula. But in case of fibula, we know that it is an accessory bone. It is not actually carrying the pressure or the weight. On the other hand, from the tibia, the weight is ultimately going into the articulated foot. And at the articulated foot, that weight will be distributed in between the tarsal, metatarsal and the phalanges, and ultimately it will go into the ground. So in this way, all the bones of the inferior extremity not only passing the weight of our body, but also they are also helping for the locomotion. So that is the initial discussion of the bones of the inferior extremity today. In the coming days, I will start with the femur, because already you have studied the hip bone and the articulated pelvis maybe. So on the next class, we will discuss about the femur. Till then, stay safe. Thank you.